The second part of point 4 is that a platelet transfusion is being considered for an other procedure. Other procedures may be included if the clinician deems these to be a low bleeding risk invasive procedure and a platelet transfusion is being considered for the procedure. So you can see there's a few examples listed on the slide, though this list is not exhaustive. You might notice that there's quite a lot of variation in the procedures. So for example, the arterial catheter insertion might not be considered invasive, but for some patients, depending on their clinical situation, it might be considered as an invasive procedure. On the other end of the spectrum, percutaneous tracheostomies we have seen to be considered as a low bleeding risk invasive procedure, but in other cases, they might be deemed a high bleeding risk invasive procedure. The real take-home message for these other procedures is that it's up to the clinician's judgment on whether these will be a low bleeding risk invasive procedure. If they are, then the patient is eligible and they can be randomised.